I'm going to quickly go through this area. What I wanted to do here was just give you a little bit of information about Cystic Fibrosis Canada, the organization. You've heard parts of what we do. I was talking a few minutes ago about research, and our team focused on research. Ian was talking about healthcare programs. In general, we are a national organization. We're a registered charity, founded back in 1960. And it's important to note that the organization was founded by parents of children with CF. And in those days, of course, the situation was extremely bleak. But these parents didn't accept that for an answer and wanted to make a change. And there were people here that said they were from Brantford. Is that correct? So our founders, the Summerhays family, the first chair of the board, Doug Summerhays and Donna, really credited with being the lead organizers in getting this movement off the ground. I don't know if you met them, but they're yes, you know them.
Yes.
Okay.
Yes.
Great. Yeah, Doug calls me every once in a while and gives me heck about something. But they're in their late 80s now, and they're still active. They're still involved with the organization. We're going to be seeing them next week at an event in Toronto. And but them and other families in those days are the reason why we're here and why this organization was founded. So our vision is a world without CF, and that continues to be that ultimate goal for our organization. The mission, in terms of how we get there, is to end CF by helping people with living with CF with targeted research, supporting and advocating for high quality care, and raising and allocating funds for those purposes. Advocacy is something that we haven't really touched on today and will not be a major focus of this day, but it certainly is a key activity of the organization. This is just very quickly showing you the various pieces of the organization and how we're organized, and our stakeholders, which include the clinics, researchers, our corporate partners, our donors, and of course families and individuals that are living with CF. And we are organized on the ground in a network of chapters across the country, and I'll show you a picture of that in a second. Our strategic plan, which is a 5-year strategy that was launched, we're about a year and a half, almost 2 years into that 5-year strategy, is focused on these 5 key pillars. I focused a bit earlier on the F section, but just to give you a quick overview, we are focused on excelling the advancement of care and advocacy. You heard a lot about the healthcare programs, and you've heard from Dr. Petter, Dr. Freitag will be speaking later. We support their work, and that's a huge hallmark in terms of what we do. Advocacy, as I mentioned a moment ago, is an important activity as well. There was talk earlier about newborn screening. That largely is a result of the efforts of CF families that we organized throughout the last decade or so. And I'm very proud to say that Quebec was the last province to come on board with newborn screening, which was officially approved this year by the government in Quebec. So that's in the process of being rolled out. As of 2018, all of the provinces across Canada have CF included in their newborn screening programs. So that's incredible news, because what that means is that for those that don't have an immediate identifiable diagnosis, we will know sooner, and clinicians such as the ones here today can start those babies on the proper treatment programs much sooner than they may have otherwise, which is great news for everyone. Networking in the NCF plan is around fundraising. Essentially, it's networking and growing revenue opportunities. And we have fundraising programs that range from local activities, like our Princess Ball coming up in Hamilton and other cities across the country just after the holidays. And you'll hear more about that from Katie, through to our walk, which is our biggest fundraiser, corporate partners. We do bingos in some communities, you name it. We're involved in various fundraising activities, including major gift campaigns. And we have launched a campaign around the CFIT, Individualized Therapy Program that I was talking about earlier, where we're trying to attract philanthropists and donors at the highest level to make those investments in cystic fibrosis. D is all about volunteer engagement and driving our community. That's part of why we're doing this here today, is to offer this as an educational and networking opportunity for families that are affected by CF. Our chapters are a huge part of that volunteer community, and Katie's going to talk about that a little bit more in a moment. And We also are very fortunate to have as part of our community Kin Canada, and we have a couple of representatives from Kin here today. They're going to speak in a moment, but I'll just say we are so fortunate to have you guys with us every step of the way. Kin Canada has been an incredible partner for Cystic Fibrosis Canada for decades, and we cannot say enough or thank you enough for the work that you guys do and for continuing to hold up CF as your major. You do so much in your communities, but CF remains constant as that major cause that you're focused on, and you're with us every step of the way. So thank you guys. The C is about communications and demonstrating impact. We have a great story to tell. We have made incredible advancements, and so the stories of people living with CF are stories that we need to share, and that's what will inspire others who are not immediately touched by the disease to give and to care and to help us with our mission. So our communications department works with our volunteers and staff across the country to ensure that we're effectively demonstrating that. And then finally focusing, which I dove a little bit deeper into around research and how we're really trying to focus on accelerating breakthroughs, targeted research. So CF-related diabetes, for example, where we're really trying to make a big difference and have a big impact. The way we use our funds are in these four core areas. So the money that's raised through our volunteers, through our chapters, through donors, corporate sponsors, Kin clubs right across the country are used in these four areas, which you've heard a little bit about through the presentations today. And these are the strategic areas that we will continue to invest in with your help and your support. We are very much a grassroots, volunteer-driven organization with chapters across the country. We're organized in regions. And so this just gives you an idea of the breadth and the depth of those chapters across the country. Pretty much in every major population center, we have a chapter that is organized and led by volunteers. So we have volunteers from a few different chapters here today, and Katie will talk a bit more about that. Katie's also going to touch on some of these things, I think, so I won't steal her thunder, but essentially there are lots of opportunities. There are many, many opportunities for patients and families to be involved, and it's not just opportunity, we need patients and families to be involved, obviously. As I said, this organization was started by a group of parents and family members that wanted to make a difference, and that hasn't changed in the last almost 60 years. So thank you for all that you do and for considering getting involved in a number of ways through our chapters. Peer support, that's another driver for bringing this group together. As Tammy said, meeting people, networking, and getting to know people who are going through those experiences, that's a great benefit to being involved with our organization, and it's part of why we exist. So hosting family events like this, advocacy, we need people to be involved in advocacy. The only reason why we have newborn screening and why we have access to medications is because of advocates, and those are people like yourselves, family members, patients with CF who are willing to step forward and say, we've got something here that's going to help us, but we need your help to allow that to happen. Fundraising is a huge part of what we do, as I said, and that's both through our activities that we organize as well as third-party events. We have families across the country that run golf tournaments and all kinds of different events that donate the proceeds to Cystic Fibrosis Canada, and we work with all those partners. Public awareness, of course, is huge, and we also have a CF Adult Advisory Group that actually has a position on our board of directors. So we have a group of adults that are living with CF. At one time, before infection control protocols came into play, there were a lot of adults with CF that actually sat on the board of directors, and of course, we can't bring them together like we used to in that way, but we do continue to seek the advice of our adult community, and they have a strong voice within the organization through that advisory group. So please connect with us. We're here for you and to work with you, and we look forward to doing that and continuing that with many of you.